Hi, good afternoon. My name is Carl Poppins, also known as CP throughout the nation and the neighborhood. And I have two distinguished guests here today. This is 21st Century Focus Group Up to the Minute. And I guarantee you one thing, that I am going to put you right up to the minute with the business that we're talking about. I want to give a shout out to my girl and my family and all my relatives and all my distant relatives and all my brothers by another mother. But I won't go any further than to say that this is a continuation of a show we had called The Destruction and Privatization of the Hospital. I would like for my guests to introduce themselves. I don't want to take up no more time than I have to, because I want you guys to be educated and hear this information, because this might be a one-time only thing. I see everybody running around talking about the hospital business and stuff, but you're going to really get the business of what really happened, what's going on, what happened beforehand. So without further ado, I would like for Dr. Smith and Dr. Smith to introduce themselves, please.
I'm Dr. Ernest Smith, retired from King Drew Medical Center in the Department of Pediatrics.
I'm Ernie Smith, Professor of Medicine at Charles R. Drew University of Medicine and Science.
So which one of you guys would like to go into details about this show, this title that we're having today? Because it's my intention to use this as an education piece so people will really be educated about what's really going down with this and how the people didn't really want the hospital here in the first place. So would you, either one of you guys, if you want to take it from there, would you take it from there, please?
The show that we did 2006 was titled The Destruction and Privatization of King Drew Medical Center. And those who viewed that show, we have a disc of that show, will see that we gave a rendition of what was going to happen almost to the letter. As you know, Martin Luther King Hospital was closed after the Center for the Medicaid and Medicare Services revoked the certification of the Martin Luther King Hospital to receive Medicare and Medicaid funding, reimbursements for the services delivered there. And shortly thereafter, the state suspended the license. So the hospital is closed as a inpatient. All they have is an urgent care, no beds for inpatient services. And that's only 12 hours a day. It's not even 24 hours. So it's nothing but not even a skilled nursing facility, because at least in a skilled nursing facility you have patients in the bed. That's what the hospital has been reduced to. This title of this one, as you know, is the Destruction of Black Medicine. We wanted to give some history of the whole destruction of the black practice of medicine, or the practice of medicine on black physicians on black people.
So, Dr. Smith, I remember some of the things you said in the last discussion we had about this. In my opinion, being one of the uninsured people that I discuss all the time, it's been have a devastating effect on me, and it had it just thinking about it. So, could you kind of tell me how this plot unfold, and what do you see?
Well, I think the very first thing is that we never go back in our own history. And therefore, we don't regard the point from which we entered the United States and the history that comes from that point of entry. And the very first thing to understand is that we were not considered to be people, that we were 3/5 of a man. So if you're 3/5 of a man, that puts you in veterinary medicine. If you're in veterinary medicine, it means that you're equal to a dog, a cat, or a cow. Now, how many people in America are generically concerned about the health of cows, unless they can catch a disease from them, right? And most folks are only concerned about their dog, but not about dogs in general. So my point then is that if we understand then that people are not concerned about you and your lack of insurance and your health, they have never been. So my point is, it's up to the degree that you are concerned and that you have people that look like you that are concerned about you, that you can get any medical care. So if we begin to look at our struggle from slavery with some of the worst stats in terms of disease, deaths, lifespan, then we couldn't even live to be 40 years old, okay? Then we've been struggling from that point upward. We made some great strides after 1865, along with the period that came after 1865 was in 1876 with the Freedmen's Bureau. But after 1910, things began to go downhill. And one of the first things that happened was that they had Abraham Flexner, who went around the United States looking at the quality of medical care and hospitals and medical schools in the United States. And as a result of his report, many of those schools were closed. For the African Americans in the United States, there were 7 medical schools. And as a result of his report, 5 were closed and only 2 were left. Now, what happened was Flint Goodrich in New Orleans moved to moved in with Meharry in Nashville, Tennessee. So that became Meharry Medical School. And Howard came out of the Freedmen's Bureau, and it was in Washington, D.C., and it stayed. And those remained the only 2 medical schools we had from 1910 on up to 67,
Yeah, 66.
when Charles Drew Medical School was founded in Los Angeles. And then the Morehouse Medical School was found sometime after that. Now the question is, why was it that Flexner was able to destroy what was then a budding health practice, a healthcare delivery system that we were developing as African American people? It was done in the name of excellence.
Mm-hmm.
But the important point was it was also segregated. So it means then that you were over in your black area, but you weren't excellent enough to practice on each other. So it means that you didn't have schools to train nurses. You didn't have schools to train doctors. You had no method of training any of your children to be anything in medicine. So you had to depend upon any white person, wherever you were, to treat you. In the South, if you went to a doctor's office and he was loaded with white patients, you waited until he was through. And if he was tired, you went back home and came back tomorrow. But he had no need to treat you because you were there. Do you understand what I'm saying? It was out the goodness of his heart in a segregated community that you didn't count. Now, when you stop and think of that, that means that all through the South, black people were not being treated for disease. They weren't able to get care. As a result, black health statistics went down. We became so deteriorated that we still have not caught up. In other words, we have the highest mortality rates, the highest morbidity rates, the highest infant mortality rates, all of that stuff. If you want to find out who's dying of what in America, just name the disease and we'll tell you it's black people. That's an inherited condition. Do you understand what I'm saying? So it means then that this is not something that because we're weak or there's something wrong with us, it's that it never was corrected since slavery. Now, when you come into 1910, and as Howard and Meharry began to try to train people, they began to build hospitals all over the United States. So the next thing you get into is you get into that era of 1950, when you had the doctors from Meharry and the doctors from Howard receiving further training at the various hospitals in the various cities of the United States. Then all of a sudden, the Hill-Burton Act came into being. Mm-hmm. Now, the Hill-Burton Act was an act that was going to give money to rebuild hospitals, to improve medical construction and care in the United States. But it had a rider. If you want the government money, you've got to desegregate it. So as a result of that, then, everybody got religion. And then what you found out then was that they were allowing black people to come into the white hospitals to be treated, and they were also allowing black nurses to come into the white hospitals to practice nursing. And gradually they were allowing some of the black physicians to come back into the hospital. Now if you then go into the various cities, for instance, Harlem Hospital in New York City, Lincoln in New York City, they both had nursing schools. They don't have them now. You went to Mercy Douglas in Philadelphia. It had a nursing school. There is no Mercy Douglas now. If you went to Providence Hospital in Chicago, Providence Hospital in Baltimore, St. Homer G. Phillips Hospital in St. Louis, Missouri, which trained a whole lot of doctors in specialties. Kate Bidding Reynolds in New York, in North Carolina. You can go all around the country and find all these black hospitals that were training black people to be nurses and to be doctors, and that was who was treating us. So that means then all through the South, if you got a care from any of a black physician or a black nurse, more than likely, they had been trained by black people. Now what does that mean? It means we were capable of training our own health personnel. And we practiced medicine until the government put money out in order to improve the hospitals in the United States, and in order to get the money, you had to tolerate black people. Now I can remember finishing Howard University in 1957. And going even to take my boards in Maryland, where we as the black folks coming out of Howard would come to Maryland to the medical office, and we'd sit at tables with kids from Johns Hopkins and from University of Maryland. We had been taught at Howard Don't take any books to the examination. And when you sit at the table, don't look at each other. So when we'd sit at the table and we'd start thinking and we'd look up and I'd see a guy from Howard looking right at me and I'd turn my head so they wouldn't accuse me of cheating. But in the meantime, here's a guy from the University of Maryland who's writing his thing out, and then his professor who's proctoring picks this paper up and reads over it and says, you know, I taught you better than that, and sit down. Or he'll get another one and tell him, well, that's not the answer. They're carrying on communication, but we're afraid to even look at each other. Now, this was our entree into the white medical schools. When I went to Fresno for my internship, I traveled with a girl in my class who was going to Sacramento. When we sat at the table, the two of us as blacks, and behind us was a whole table of new white interns, and we heard them in their conversation. Well, what are they doing here? And then one says, well, I don't mind practicing with them. He said, well, I won't practice with them. And my friend who'd just come out of Howard just broke down and cried because she was going to be the only black intern at Sacramento County Hospital at that time. And my point was, well, Sarah, you just have to fight. You have to just get your business together and fight. That's what this is all about. I went down to Fresno and met a completely different attitude. In other words, most of the guys that I was meeting down at Fresno were from Iowa. They didn't have the racial prejudice with them. But still in all, when I came in, I was the only black intern coming in, even though there had been other black interns that had broken in. And I give you that long history to let you know, I came in as a physician in 1957. Now, the reason that we were being treated fairly well in these new hospitals was because the black nurses had already been there. And it was the black nurses who no one talks about, who opened up all of those hospitals that received black physicians. The black nurses that came out of Freedman's Hospital and Harlem Hospital and Lincoln Hospital and all these black hospitals that had been trained all around the country, they did an excellent job in opening up these hospitals, and as a result, we were received. Now, that's talking about that era. Now, if you were to ask them, well, why didn't you receive black people? Why did you not want them there? They will bring you down to three major issues. Excellence. We're inferior. Okay? The other thing is we're unethical. Okay? And the next thing is we're in the process of desegregating. So we're becoming good people, but you still remain inferior, okay, and you still remain unethical. That started off with Flexner. That came down in 1950 when they finally got rid of all these hospitals in the United States. And it came on up to 1960s when they started in with Medicare. Now, what is Medicare? Medicare is an insurance policy, isn't it, for the poor? Well, if it's an insurance policy for the poor, it means money. What's the difference between Medicare coming in from the government, paying people who work on poor people money, and people going to the government to get money to build hospitals? None. So that means then the same greedy people that got money to build hospitals now are looking at the Medicare money. Now, they weren't treating poor people because they treat people with insurances, mostly white or whatever it was. As the industry in the United States began to go down, then the Medicare dollar began to look very good. People began to talk about black doctors, and I can remember conversations when I was at Ford's Hospital in the 1960s. The Detroit Medical Society was trying to meet with the people at Ford's Hospital, which was one of the top 10 in the country, and they didn't want to meet with them. I happened to be one of the few black folks on the staff, and I'd hear them talking to each other as though I wasn't there. Well, what do they want from us? And they always wanted to interfere with us. And here comes this doctor demanding to speak to me with his gold watch and his big rings and his perfume, okay, driving his big car. In other words, there was a jealousy because the black doctor, for the first time in the history of the United States, was being paid for work done. Before that, he was treating African-American people who had no money. If he was in the South, he was getting eggs and chickens for pay or eating the cost up himself. Now he was getting money. Now, being that he's an African-American, he ain't going to put the money in stock. You know what that is. He's going to buy himself a nice car, and he's going to have some decent food, and he's going to dress to the nines and look good, okay? Now, that doesn't mean that's all he is about, but that's his method of presentation. Well, it caused jealousy. Well, the first thing you know, in comes the new HMO movement. It started here in Los Angeles. I remember now working at King Hospital. That was back in the 70s. And I'd be out in the community, especially in the Compton community, and I would see where black people had been approached by white ladies who were signing them up for this new program. And all of their Medicare stickers would be going to this new program. if they didn't give up their Medicare stickers to the new program, they couldn't get treatment. So as a result, these people, blacks, who were being treated by private doctors in Compton and in South Central Los Angeles, then withdrawing from that doctor's practice and now hooked up to this new methodology that was coming along. It was called the HMO. Okay? Now what did they find? That the HMO had the sanction of the state of California. They didn't have offices. They didn't have hospitals. They had nothing. Okay? But they used the money that they had gathered to create the office and to create the hospitals. But in the meantime, the black physicians now were losing out in terms of patients and money. So what do we see here now? We see the destruction of private practice amongst black physicians. Okay? What impact did that have? Well, we're right back to where we were in 1910. We don't have now black physicians in the community. And as a result, then, it affects the health in the community. But more than that, it affects the economics of the community. So in other words, where you had doctors almost in every block or so practicing medicine, they were also using the money that they earned in that community. Now you go to your HMO down in Gardena, or you go up to wherever Kaiser is, those doctors don't live in your community, and the people that are working there hardly live in your community, so your dollars never come back to your community. So one of the things that happened is you interfered with the economics, of which the medical practice was a solid foundation, along with education, teachers, et cetera, then you begin to pull that out. So what we then saw was the breakdown of the practice of medicine in the African American community. Who got the money? HMO people. These people were not trained in medicine. They were not trained in, had nothing to do with health delivery. All they were businessmen, and they got the top dollar. The thing that blew up in everybody's face was then they began to determine how you're going to practice. So that you hear now like a lot of the white physicians who find that they can't practice medicine like they wanted to because they have to go according to the way the man that has the money determines how that medicine is going to be practiced. But they didn't come to the aid of the black physician when we began to cry out about what was coming down with this change in management. Right. Now what did they do to the black physicians? As they begin to say, we're going to drive you out of business, one of the first things they began to do was they wouldn't pay you. So delayed payment. So you fill out your bills and you send it into Sacramento, and Sacramento just sat on them. So many of the physicians then would go into their private money to pay their staff. But after a while, you get broke. So before you know anything, you can't afford to practice medicine. If you were hanging on, then the next thing they did, they raided your office. So they would declare that you're doing something illegal and something wrong. So we come into your office and we take out scads of charts. And we take those charts out to wherever they take them. You have patients coming in, but there's no record here that you can work from because the state has your record. The next thing they would do is they would accuse you of whatever wrong that they said you did in terms of billing or whatever. And then they would arrest you, and then you had to get a lawyer and go to court. So in other words, it just didn't happen that they were able to seduce patients to come to them. They also had a program that also went actively against the black practitioner. If you look at the nursing, okay, we no longer had nursing schools in every city that catered to teaching black young girls to be nurses and later young men. Now you had to go into the white establishment for education. You take the SAT, you take the test, do you qualify or whatever it is, right? Which more than likely you're going to get the talented 10th, as Du Bois talked about. But when we had our black schools, they could see in that youngster there was potential. And then they would work with that child and develop that child into whatever it was that they were supposed to be. See, that was all gone. The issue that they raised then again was that the reason we did this was to rescue the African-American patient from the African-American doctor who was not excellent, okay, and that he was immoral. Do you follow? And whatever else they want to say, that the same thing that they were saying in 1910, the same thing they were saying in 1950, then when it came down to 2000, the same issues again began to occur, okay? So as a result then, when you come down to King Hospital then is on that same track of legacy, meaning you can't be excellent. You got to be immoral. And the third thing I was saying was ethical. Well, that's ethical, the same thing.
The segregation?
Excellence.
And segregation, right.
Segregation.
So that means that you can't be out there by yourself because we desegregated with the Hill Burton in 1950, right? Now, if you have King Drew and it wants to be a black medical school, a black hospital, and Drew is a black medical school, we can't have that. So we've got to integrate, right?
Mm-hmm.
So we do. So now Drew is a historically black and a Hispanic serving institution, right? That's good. That's good. How many black kids graduated in class of 2007 at Drew?
2 blacks and 1 continental African.
And how many were in the class?
25.
25. How'd you get to there?
Good question.
When we started with the first class, which was about 1985, you had almost 15 to 20 blacks. And when you end up in 2007, you got 2. So now the point being, so we integrated and we lost. They came at Howard with the same point. They came at Meharry with the same point. You got to integrate. But as you integrate, then they say, okay, it's all right because we're going to take more of your black students into the white schools, and so that'll balance out. No, that's not the point. The point is we still don't have enough people who deliver health care in the black community, okay? And as a result, then, we find that our health is not changing. It's not getting better. Nothing is happening, okay? So it means then that in proportion to what was going on in 1910, it is still going on in the same proportion. The highest infant mortality rate in the United States is with black women, and it's double that of whites and Hispanics. My point is, how could we be so far off? The AIDS epidemic that's striking mostly black women in the United States, far out of sight compared to Hispanic or white women. Everywhere you turn in terms of where we are today, it's still about excessive mortality and excessive morbidity. So this is the history and the background as far as Drew School is concerned.
Okay. Let me chime in here because we want to give a perspective on this that goes 6,000 years ago, when black people were in fact the people who contributed significantly to the science of medicine, and namely Imhotep, the Egyptian or Kemetic doctor. And we have a legacy of the writings and works of open heart surgeries and the kinds of surgeries and things that were going on 6,000 years ago in Africa. Now they claim that Egypt is in the Middle East. So what you have to confront here is the whole notion of white supremacy. And I'm going to share with you 3 laws because I think these 3 laws are very important. They were laws that were named by Wade Nobles, a psychologist at San Francisco State. The law of not knowing, the law of not being, and the law of undoing. Wade Nobles says that if you don't understand white supremacy, everything else that you think you know is only going to confuse you. So you must look at the destruction of the black practice of medicine on black people in the context of white supremacy. You have to look at it through the sieve of white supremacy, because once you look at it in those terms, you can understand why the African doctors were considered voodoo or witch doctors, okay? And the Native American practitioners of medicine were medicine men, and the medical practitioners in India were considered shamans, okay? Everyone who does not practice medicine according to Eurocentric white supremacist concepts, okay, is not qualified or is deemed not excellent. Now, Harvard University has a morgue. Stanford University Hospital has a morgue. Cedars-Sinai has a morgue. USC, LA County USC, and UCLA, Harvard UCLA has a morgue. So I don't know what they mean by excellence when every hospital in this nation has a morgue. Okay, so this notion that white medicine is so all that and a bag of chips, you can put that under your fingernail. It ain't there. Okay, there's no such thing as excellence by the criteria that they would try to hold you to. Okay, if every hospital in this nation and all over the world has a morgue, that means people die in all kinds of situations. So to try to label black medicine as not excellent, tell me what excellence is, okay? Because I know that a hospital that had a trauma center that was training physicians in trauma care, emergency medicine for the United States Army, was one of the highest rated trauma centers in the nation.
Excuse me, if you guys want to contact either of these people, I'll have a number at the end of the show. We're going to end this show and get right back into you, Dr. Smith, with that because we don't want to lose none of you. Again, this is CP 21st Century Focus Group Up to the Minute, and please stay tuned for the next segment of this show. Thank you.
Said 28 minutes went
Yeah,
fast.
that did, yeah. Good. That's all right.
Yeah, 28.